So uterine fibroids are a reproductive issue that more and more women are experiencing, and it can be a huge factor in infertility. So what is a uterine fibroid? So it's a growth in the uterus. It's a muscle tumor, but uterine fibroids are almost always benign, meaning that they are not typically cancerous. But again, they can create a lot of issues when a woman is trying to get pregnant. They can also cause abdominal pain and really heavy, really painful periods. And so the reason why it can impact pregnancy is if the fibroids are growing in or into the uterine cavity, they can essentially, block the embryo from attaching to the uterine lining and developing, because again, the uterine cavity is where the embryo needs to attach and grow. So the fibroids can mess up that process. Sometimes if the fibroids are small, they grow within the muscle or just on the surface of the uterus, they might not impact pregnancy too much. Okay, so to diagnose fibroids, typically a doctor, or especially a fertility specialist, they can do this by doing a pelvic exam. A lot of times they can feel the fibroids during a pelvic exam. Ultrasound is often used as well. This allows the doctor to view the fibroids, assess them, and if the woman is trying to become pregnant and the doctor feels that the fibroids are the main cause of infertility, or if a woman is experiencing excessive pain from the fibroids, the doctor might recommend a minimally invasive surgery. So there's the two most common surgeries for fibroid removal. One is a hysteroscopy, and a hysteroscopy involves the doctor passing a thin lighted telescope through the vagina and cervix into the uterus. They then use gas or fluid to inflate the uterus to improve visibility. They can then, evaluate the fibroids more in depth, and then they can use a specialized tool to remove the fibroids. A laparoscopy, it's very similar to a hysteroscopy. The main difference is that instead of going through the vagina, there is an incision made in the belly button, and they go in through there. They inflate the uterus using gas or fluid. They use the same kind of telescope. They pass that through the incision to provide that in-depth view of the uterus, and then they can remove the fibroids. The really important thing to remember about this, though, is oftentimes the fibroids grow back. So it's important that right after that procedure is done, the woman either tries to get pregnant the traditional way, or, if she really wants to increase her chances of becoming pregnant, she might opt to do a fertility treatment such as IUI, which is intrauterine insemination, or IVF, in vitro fertilization. So if you have really heavy periods, if you just feel bloated a lot, if you have weird unexplainable abdominal pain, I highly recommend going to see your obstetrician, asking them about the potential fibroids, asking for an exam to assess if there are fibroids, and really getting to the bottom of it. All right, if you have any questions about this, anything else about fertility, pregnancy, childbirth, parenthood, let me know in the comments below.